Hello, good morning, Mr. Browar. Thank you so much for participating in this chemistry and careers project interview today. My name is Jasmine, and this is Scott Browar here with the professor and nursing instructor at Fresno State University.
Good morning, Jasmine. Thank you for inviting nursing.
Good morning. And so we're going to just dive right in here with our general questions. So, what was your educational pathway to get to your career?
I joined the military at 17. I became a Navy hospital corpsman stationed with the Marine Corps. Upon my return from my Vietnam deployment, I challenged the LVN and subsequently got my RN, uh, bachelor's degree, master's, healthcare administration, post grad work in hospital administration, about a year away from a doctorate in business administration.
Amazing. Those are some awesome accomplishments. Congratulations.
Thank you.
And how long do you think that took you to finish your schooling?
Almost 30 years.
Nice. Did you obtain, you said you had obtained your bachelor's degree and you went all the way up to your doctorate's degree as well.
Didn't finish my doctorate. I got out of healthcare administration, went back into clinical as a nurse as well as academia. I've been with Fresno State for 10 years now.
Oh, that's amazing. Congratulations.
Thank you.
And what were some challenges that you encountered when trying to become a nurse?
Well, in the 1970s and 80s, being a veteran was not very popular. Also, when I entered nursing, nationally, less than 5% of nurses were men. And so there was kind of a glass ceiling for us at the time as well.
Wow,
Um,
okay.
yeah, kind of different now, but yes.
Mhm.
And then uh, I just continued to follow my clinical and educational pathways. And as I went into administration, uh, I just kept studying because, as I'm sure you're aware, our science continues to evolve.
Yes, it is a forever adapting environment.
True
So,
that.
yeah, that's an awesome story and very great job at seeing it through.
Thank
That's
you.
a lot of hard work and dedication. So, going on into the science aspect of your career, what science courses would you say helped you the most in your profession?
Without question, chemistry, organic chemistry, um, anatomy, physiology, and advanced physiologic studies as I progressed as a nurse. Um,
All right.
Definitely health and human services, um, everything from mental health disorders to colleagues that have emotional fatigue.
And can you relate your everyday work to your past schooling and labs?
I'm sorry, repeat that, please. I'm sorry, Jasmine.
Can can you relate your everyday work to your past schooling and labs?
Yes. Well, currently, I've retired as a clinical nurse. Here at Fresno State, I am the interim coordinator of our simulation lab. And previously, I was the coordinator of our resource center, our skills lab. Uh, I've done many, many clinicals. Currently, I have a clinical leadership course where our fifth semester students go into hospitals. And for the last semester, they try and go to a unit that has some interest to them to see that once they do get pinned and graduate and get their national certification, licensure, actually, the NCLEX, it's a daily. Everything from anatomy, physiology. I do critical care lecture for cardiovascular health, critical care. And so talking about the different diseases, the etiologies, the treatments, and current new standards of care.
Right. Yeah, amazing. And that's an awesome opportunity for your students to get some hands-on experience as well. How would you say the science and technology has evolved since you started your career?
Greatly. When I
Hmm.
started, of course, there was
In the
no
70s.
DNA.
Hmm.
Yes. Yeah, in the 70s, right. Nobody had
Hmm.
even heard of DNA.
Wow.
Uh, yeah, it was blood type is all we had to differentiate some things. Lab testing, without a doubt, were far able, much quicker and more efficiently and effectively to make medical diagnoses by blood, radiology, neuroscience. That it's changed very dramatically. And then the science too of things like resuscitation, that's
Hmm.
always evolving. Medications, my goodness, every year we get a list of 40 or 50 medications that are directly related to our sinus that are approved by the FDA. So that is also ongoing study for myself and our students.
Right. Oh, awesome. So, chemistry related questions I have for you here are medications can interact with one another and have possible chemical reactions. Has this ever been an issue for you in your career?
Many times, and the potential is always there. Used to
Right.
be, yeah, back in the day, there were two or three antibiotics, with penicillin, of course, being the
Mhm.
primary. But now there's broad spectrum. There's probably six or seven or eight generations of antibiotics by themselves.
Oh, yeah.
We work very closely with what we call vasoactive medications to increase blood pressure, to decrease blood pressure, to increase contractility of the heart, renal perfusion. So every day it's part of our practice as professional nurses.
Mhm. And have you had any patients experience any adverse reactions to medication before?
Many times,
A
to
lot.
the point, yes, yes.
What a scary situation.
It certainly is when it happens precipitously. Yes, I'm sure you're aware of anaphylaxis. Uh,
Yes.
and so now some of the medications we give, well, first, of course, is blood. There's always a chance of a hemolytic response. So whenever we're administering blood, we're on high alert. Um, some of the medical, sorry about my lights.
No worries.
Yeah. Some of the other medications, I've had patients go into full-blown anaphylaxis where we actually had to resuscitate them. Recently had a man who was, his wife was shopping at Costco. So, of course, being the dutiful husband, he was collecting the little souffle cups of all the freebies. And he came
Mhm.
into emergency department and his throat closed completely. And so we had to do what we call a surgical cricothyrotomy, basically an emergent tracheostomy. And fortunately, this gentleman recovered, but it was pretty,
Nice.
it was dicey for about 45 minutes.
What a rewarding position that put you in. I'm sure you felt amazing to bring him back. That's
Great
awesome.
sense of gratification. Yes.
And on another note, do you ever use chemical strips, for example, for like a urinalysis or like coliform testing? What kind of daily test strips or chemical strips do you guys use? Or even for, your simulation lab, do you guys use them?
Yes, we do. So urine dipsticks, certainly. Blood glucose, anyone that has any kind of altered sensorium, whether it's cardiac arrest or passing out or a seizure. We do those on all of our patients.
Oh,
What
great.
other? We check for cerebral spinal fluid if fluid is coming out of one of our victims' ears or nose or mouth. Um,
Oh, wow, that's an out of the box answer. I didn't
it
even
is,
consider that. Wow,
yes.
that's
And the
really good
most,
to know.
oh, I'm sorry. The most recent now is the FDA has approved a dipstick for fentanyl.
Oh,
So
wow.
when people buy the on the street or order it through China or through one of the Mexican drug cartels, there's a test strip you can dip in. It's like a specimen container. There's a dipstick. You put your water, you put your pill in, and it tells you if there's fentanyl in there. And I'm sure you're aware
Cool.
of all of the terrible fatalities. Good
Mm-hmm.
news is this last calendar year from June 23 to 24, in calendar year 2023, there were 114,000 narcotic deaths in the United States
Wow.
1 year. So from June to this past
Shocking.
June, yeah, it's been catastrophic. And these are
Mhm.
more often than not young, healthy people. We think of the folks that are, unhoused or have some kind of, emotional issues. It's the young folks. So the good news is, as of June of this year, it's down to 98,000, about 14%. Um,
That is
that,
good.
that's a milestone for us, yes,
Absolutely. What a breakthrough and advancement of technology we have nowadays. That's great.
truly.
So, that is all the questions I have for you today. Thank you so much for taking the time out of your day to complete this interview with me. I really appreciate that.
Pleasure. Hi to everybody in Organic Chem. Thank you and appreciate you contacting me, Jasmine. Very best of fortune
Thank you. Have a wonderful day.
as well. Have a great holiday. Thank you for
Thank you.
contacting me. Bye.
Thank you. Bye bye.